Their entire life that they have been in existence has been told to them by what the medical paradigm has really deemed to be appropriate, which is oftentimes going to be a pain-based model.
Welcome to AMC. I'm Dr. Greg Miller. Are you interested in learning how to maximize the patient experience? Today, Dr. Megan Malone is going to share more details on this topic. You won't want to miss her tips on office displays. Let's get started.
Hi, I'm Dr. Malone, and I'm here to talk with you today about patient retention. And honestly, how to achieve that higher level practice, that more maybe wellness-based practice or less acute pain practice that you've been seeking. So I think for most of us in chiropractic, we really wanted to have a more proactive care approach when dealing with our patients as opposed to a strictly reactive, based approach. So if you're in that situation and your clinic is like all you're seeing are these acute hot low backs or, acute conditions, and you really would like to see that balance, like you don't want to necessarily not see those patients, but you also would like to see, those ones that are just coming in because they want to stay healthy and they're looking for that next way to be healthier, then this is what we're talking about here, and this all comes from your patient retention. And if you don't know how to calculate this number, this is the first place we want to start at. So for patient retention, what you're looking at is your patient visit average. How often or how many visits does that new patient come into your office before dismissing themselves from care? Now, don't get me wrong, I understand some of these patients will come in and see you, 300 times, like they've been with you for 30 years or 10 years or however long, and others are only hanging around 5 or 6 visits, but this allows us to see the average overall. So the easiest way to calculate this is you're going to take your total number of patient visits and divide it out by your total number of new patients. So let's just keep the math simple, because I like simple. So let's say that you saw 400 patient visits in a month and you had 10 new patients. They take that division, that's going to be on average, the patient's going to stay with you about 40 visits. That is a pretty good number. That's a pretty good number suggesting that you're getting that even balance between, your acute cases and you're getting, your people who are coming into you to stay healthy. I think one of the things that we see in chiropractic is that a lot of chiropractors will say, 2, 3, 4, 5 years out that they're burnt out. And I think part of that really comes into not living, not having that practice and that lifestyle that they are expecting to have, if you are a proactive person, if you value your health and you got into chiropractic because you looked at it and said, I know there are natural options and I know there are ways to amplify the body's optimization to stay healthy, that's your mission. That's what you love. You don't want to fit into that necessarily more allopathic model, which is like, hey, come in when you feel bad. We'll fix you up, pat you on your back, and then see you next time. And I think that's where we can get into like that mundane, like this is just keeps going on and on and on type of practice. In AMC, we like to call that a mineral oil practice, right? And they come out, they go. And we really prefer the idea of having patients that stick with you long term. So for me, this became a mission a few years ago. And I am so very glad that I went on this mission to really enhance my patients' experience, to ultimately give them the best quality of life. And then thus I can have a practice that I feel really happy and fulfilled to come into every day. So let's talk about a couple of those things. So first, you need to know your numbers. You need to know where you sit, because that's going to help you to understand, okay, where am I at? How are my patients, how are my patients feeling about this? So let's say that your number comes in like really low. Maybe it's like a 3 or a 4 or a 5 or a 6. I think the national average is somewhere around 7 to 8 visits is the national average for chiropractors for patient visits. And that blows my mind, because I know the majority of you guys are out there wanting your patients to stay with you long term so you can have that proactive approach to their healthcare. So you can really aid them in that. So first you need to know your number. And then you need to think about, okay, what's going on in the patient's mind, So when the patient comes into your office, they're initially coming in typically because they have a complaint. And part of that transition for them is going to be them understanding that their complaint is one that they have now, but once we reach it to a higher level, then we can actually get them to the point where we can maybe be preventative with it, you know? But a lot of people don't make that transition, and that ultimately comes down to a few things. Like, one, what is the culture like in your office? Is the culture in your office really breeding one of wellness care, right? So like, if you were to walk through my office, you are going to see patient testimonials lining the walls. And when we're looking at those patient testimonials, part of what we're going to see on the walls are those who are talking about their proactive or their wellness care. Not just like those miracle cases where like I couldn't walk on the way in and then I could walk on the way out. Or the, I have a lot of, pregnancy, pediatrics, like hormonal based clinic here. So they're not just necessarily going to be my baby couldn't latch and now they can. They're going to also be the situation of like, I bring my child to Dr. Malone because I want her to stay healthy. I love working with the infants and stuff like that, but one of the things that I absolutely love about it is that some of my infants, a good majority of them that come in, are actually coming in because they know that the subluxation can be present after birth. And we can help them right there from the beginning. And so we don't have to go through all of the colicky, constipation, reflux babies that are just, tortured. We can actually be part of keeping them healthy from the beginning, So your culture in your clinic is going to read a lot into this. So first off, what are you displaying? When you take a look in your clinic, are you looking like a pain-based model? Or does it have more of a wholeness, wellness type of vibe? If you were to walk into our therapy area, our resting area, we have a little kids section in there as well. You're going to see probably 30-ish, I don't know, maybe more, pictures of me with the babies that I treat, or with the various ages of kids that I see, so it's going to be me with a little tiny baby with a little finger contact, or, one of the kiddos laughing as I'm doing an abdominal release. So it starts to spark the attention of the parents who are coming in, and they're like, wait, you see kids? Yeah, we definitely see children, because we believe in having a proactive approach to their lifestyle. And they're like, I do too. So oftentimes parents will bring their children in just because of that alone, right? And that's already getting them changing in that mindset. The other thing that you really want to be thinking about is your patient education piece. If your patients don't understand wellness care, they're not going to do wellness care. Their entire life that they have been in existence has been told to them by what the medical paradigm has really deemed to be appropriate, which is oftentimes going to be a pain-based model, right? Or a symptom-based model. You don't feel well, you come in, right? Like that's typically what they're used to seeing. So in order for us to really help them, we have to help make that transition. So we do several things. In the AMC system, we have several place marks kind of set up to make sure that we're getting that patient education without taking like so much time out of the office visit where we're not able to be as effective and as efficient for our other day-to-day operations. So there's ways that we can kind of have little benchmark checks to make sure that we're hitting those things there. But your patient orientation class is such a huge part of this, and really bringing you into it. And this is a perfect opportunity for you to share your passion for what it is that you do. When we talk about creating a patient experience where the patient just absolutely loves and wants to be part of, they need to understand you. We're in such a world of where people are craving authenticity. And I am by no means am I saying to go have what we would call a friendship practice where you tell them about every part of your life and you guys joke about golfing on the weekends and stuff like that. No, they need to know, why are you doing what you're doing and why are you called to this? This is really a huge part. If you start to look at just how marketing has worked over the last decade or so, there's more and more of that craving of they want to know, oh, well, who else uses your product and why do they use their product? And, so for you to be there and just explain in your patient orientation class your why, it's going to change that culture and the people are going to understand, and then they are going to be more apt to do those things. So when we talk about, the patient experience, it all will begin with your front desk. So you need to make sure that when you are looking at that front desk, that it is just a center of happiness and welcoming, right? That person is just like, I feel welcomed here. I feel like this is a second home. I mean, we have so many families that we see in here that their kids, they literally just treat this like their second home. They don't even know there's a difference. They walk in, they just go straight to the toys and they play, and they come in and they bring us colored pictures all the time. I mean, literally like so many pictures, and it's so beautiful. That's because we're creating this wellness type approach. They feel like they're at home when they come in. And that's really the vibe that you want to be giving, especially when they initially enter. You want to have a very welcoming, very open vibe. Then when they get through the other portions, of the system, we'll even start on day one with an AMC. We'll start talking with them about kind of planting a seed for, okay, so I see that you have this condition. Would you like to essentially, if there were options for you to stay healthy, would you want to do that too, And we're kind of just throwing those little nuggets in there so that eventually when they decide or they want to make that option to come into what we would consider like a wellness or a maintenance plan or whatever you guys want to call it, then they have that opportunity to do so. So that's really the foundation of it, right? We need to have an appropriate culture. We need to really seriously educate the patients, and I cannot express this one enough, so I'm gonna get a little bit closer to the camera so you can really see my intention with this. This is not something that should be done like once or twice. This is something that should be done all the time. However, if you're in a really busy clinic, you're probably thinking, okay, she's nuts. How am I gonna do that? I don't have enough time. If you are appropriately doing your patient orientation class, you will not be answering this same question patient after patient after patient. That is the purpose, or at least one of the purposes of doing a class, is so that the patient gets the education and you don't have to spend an extra 10 or 15 minutes in the room with them every other visit explaining something you could have done in that patient orientation class. So if you guys are doing that, I'm almost gonna bet you guys are not doing a patient orientation class. So I'll just leave it at that. But I really just want you guys to understand, if you want to increase that patient relationship, that patient experience, and you want to have that higher level wellness-based type practice, that one where you are not constantly feeling like, okay, what's it gonna be today? Well, then you're gonna have to change what you do, and that's gonna be constant communication and education with that patient, loving on that patient, creating that welcoming environment, and ultimately that culture. So those are the things that I really started working on a few years ago, and that changed everything for me because I just couldn't handle every single time, just working through new patient, and not really getting to that point where my patients were staying. To me, it became very frustrating to think about this idea that they're coming in and they're staying for a little bit and then they're out. That just really isn't very satisfying, because I know that I don't just want to get one adjustment or 10 adjustments for my entire life. I really want to make sure that I stay well, and it's a huge part of my lifestyle that I make sure that I get checked regularly, that my child gets checked regularly, that my family is on top of their health. So I didn't want that in my clinic either. And you have that opportunity as well. Just following some basic steps, you can absolutely create a culture that your patients know and understand and ultimately desire, just like you do. So I hope that this was helpful. If you guys need anything else, don't hesitate to reach out. Love and appreciate every single one of you guys, and thank you for doing what you do in chiropractic.
Join us at our next training weekend, October 14th through 17th. If you're new to AMC and would like a free guest pass to 3 days of material like this, text us at 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice.